Make sure to record. And ladies and gentlemen, Kevin McNicholas, most of you know me, and Chaz is the fun, cool guy at the party that everybody really came to see. So I'm going to hush and let him take this over. Really looking forward to this presentation today. I've seen Chaz offer this a couple of times before, and it gets better and more informative every time I hear it. Chaz, much appreciated. You go ahead and take it away. Thank you, sir.
Well, if I could get to my controls that are now hidden from, because I can't get to them because of the Zoom thing. Can't get to my.
If you want to, I was gonna
Awesome.
say, if you want to stop screen share and then start over again, if you want, that might help.
Okay, now let's see what happens when I share. All right. Hopefully everybody can see that. Yeah, that's. Damn.
Yeah, I think that looks good. I got that.
That the control button is, or slide is right in my way though, still. I can't even see my presentation completely. I don't know how to. Nope, that wasn't it. Sorry.
Chaz, if you go to view, you should be able to hide that if you go up towards the top. If you're in full screen, it should say view, and you've got like side-by-side speaker, side-by-side multi-speaker.
No, I don't have that.
Oh, gosh darn. Okay.
I've got a video bar that's covering half my presentation and the control bar that's on the other half, and I can't even tag it to the side, which would be fine. All right, well, I'll try to get going through this anyway. See what I can do here. Okay. So my name's Swearingen. I'm with Lincoln Prairie Behavioral Health Center. I'm going to try to get through this quickly since I know that we've already lost several minutes here, guys. I have been with Lincoln Prairie now for since end of 2018. So it's like 6.5 years for me. And when I joined Lincoln Prairie, I had really most of my recent experience with kids had been in crisis and with SAS and working with them on the sort of evaluation side of things, where I would go out and I would do the evaluation for the kids, and I would help determine whether they needed to go someplace to keep them safe, that kind of thing. So when I joined Lincoln Prairie, they asked me to sort of take over or help sort of support the LGBTQ program at Lincoln Prairie. And wouldn't say I was completely ignorant of it, but I was certainly far from an expert, and I wouldn't even consider myself an expert now. But I do have a presentation that I've given several times. With many things, you learn as you go, and I've learned a lot from the LGBTQ kids that I work with. So let's go over some of the objectives here. First of all, this is unabashedly a pro LGBTQ presentation. I'm here to sort of advocate for LGBTQ people as well as mostly kids, because that's what we deal with at Lincoln Prairie. I'm going to cite actual statistics and research, and I'm going to talk about proper terms and language. And then finally, at the end, I'd like to answer questions and give any kind of advice or anything like that. I like to do that at the end because a lot of times I've found that if I do it during the middle, people will ask a question and that's my next slide, for instance, or something like that. So if you could hold on to those, or you can type in the chat and we can handle them at the end. Kevin's good at managing that kind of stuff. So we'll get into it. So first of all, we ask, why is, someone who's LGBTQ, why is that an issue even for a mental health professional or a teacher or administrator or parent, clergy, whatever? It doesn't have to be mental health professionals entirely. So here's why. There was a study from the American Foundation for Suicide Prevention, who I actually volunteer for sometimes. And this is just suicide attempts among transgender and gender nonconforming adults, for instance. And if you look at the percentages there, I'm not one to read off everything I've got there. Most of you can read, I think. So hopefully this will help. But it just seems like a wide variety, a wide percentage of people who are transgender or non-binary have encountered some sort of, um, you know, a lot of adversity. And the percentages here are actual suicide attempts. This is not suicidal ideation. These are attempts. So, you're talking about like 38, 44% of transgender males. I mean, that's almost half who have attempted. So there's definitely some attention that needs to be on there. What else does the research say? Well, if you're LGBTQ, it's a risk factor to be bullied, discriminated against. You encounter more violence, increased anxiety, depression, and other stressors, which can lead to a lot of other things. 78% of trans people were harassed in school. 59% experienced rejection from their families. And when I did a group at Lincoln Prairie, an inpatient group for kids and with PFLAG, I don't know that it was every single meeting, but I would say, 90 some percent, there was at least one kid who said, if I come out or I came out or I said this and now I have been rejected from that one final person who supported me. Because the kids that come into our hospital already are sort of rejected from their um, primary support group. And they've had to turn to, say, like, that nice aunt or uncle or something like that. And then they've said, hey, my trusting aunt, I'm gay. And that aunt said, hey, well, you're not welcome here anymore. So that happens so often. Rejection from families, rejection from other support groups. It's bad. So there was a report from the CDC that talked about what it meant to create a safe and supportive school environment where LGBTQ youth feel connected to people, in a way that promotes their health and well-being. And obviously, they found that youth are at a greater risk for poor mental health, violence, and HIV than their non-LGBTQ peers. But they also found that when schools implement LGBTQ plus supportive policies and practices, all students experience better health outcomes. And that's not just the LGBTQ kids, that's all kids. Something to think of. So, like when you're asking when straight month, it's like asking where the non-disabled parking spots are, right? I like this because it kind of highlights. There was an issue a couple of years ago where I was asked, a parent was asking about a pride flag and wanted to know, what all the colors meant for everything. And I actually had to do some research because there is thought on all the pride flags with what the colors mean and where they go. And I shared all that, and the question was, well, which color is the straight color? And I said, they all are. That's the point. Straight people get all the colors. All the colors. So we're going to go over some of the terms. LGBTQIAPD. There's a ton of letters after that. I usually stop after Q. I know a lot say LGBTQIA plus. That covers a lot of things. For me, I'm going to talk about the fact that Q is one of the most important for the kids that I am around the most. Um, Without sounding too much like a Dr. Seuss book, L is for lesbian, G is for gay, B is for bisexual, T is for transgender, and then you get to Q. Q can be queer or questioning. Queer is usually used anymore as a term that LGBTQ people use for themselves. I don't use that term unless I'm having a conversation with somebody who has used that term because I'm not a member of the LGBTQ uh, of you know family. I don't feel like I can use that term, not being part of that. So I use questioning. Questioning, I think, really for the kids, especially if they feel like they're somewhere on the spectrum, which I call it, of LGBTQ. Questioning is what they're really doing. They're thinking about a lot of different things about themselves. You know, what are these feelings I'm feeling? Like I know at one point, like I really liked this girl, but now I'm kind of feeling attraction to this guy too. So what does that mean? And is that just like this one individual person? You know, or I don't feel like a man really. I feel like I'm always like gravitated to sort of, I don't know, I feel like I'm more present as a woman, that kind of thing. So there's a lot of questions for kids, especially when they are going through a lot of different periods. They're trying to figure things out. I is for intersex, and intersex is someone who is born with characteristics of two of the binary genders, male and female. Asexual, A stands for asexual or ally. Usually, asexual means that someone is really not that interested in sex or doesn't really have attractions to people in general, or it could be a very low attraction. Um, and then you have pansexual, which is basically being able to be attracted to anybody, whether it is someone who is, male, female, non-binary, trans, whatever. And then you get into the demisexual uh, terms, and demi basically means that they have an attraction, but it is based on like some sort of emotional foundation. So in other words, they may even be or feel like they're kind of asexual, but once they start to get to know somebody, that's where then they start getting an attraction. So what are some myths? Well, first of all, let's see if I'm getting bars in my way. Um, LGBTQ being gay used to be a mental disorder. It is not a mental disorder. It used to actually be in the DSM that it was such. Um, but there are higher risks for LGBTQ people because of a lot of the things they suffer from. Um, it's not new. There's a long history in many cultures. Western culture, oddly enough, is among one of the last to integrate the non-binary gender. Um, they say that children are more at risk from LGBTQ than hetero, like sex offenders. That's been one that's been perpetrated for forever. That old Mister Johnson down in the corner there, he's gay and he's gonna take your kids. Well, that's not the case. Um, Also, sex partners are not more likely to harm children. There is a myth that sexual orientation parents with uh, role modeling, they may, if you've got two dads, for instance, that you're going to basically turn your kid gay. That does not happen. Um, there's no shorter life expectancy from LGBTQ. There may be studies that have shown that in the past, and that may be because they experience greater violence, so you can then attribute that to this or that, ever to this. But just because you're gay doesn't mean your heart's going to give out, 10 years earlier or something like that. And studies do show that orientation is caused by a combination of genetics and environment. It's not a choice. It's not something that, you decide, oh, you know what? I think today I'm going to be gay. No more than I decided I was going to be straight. I like what I like and I act how I act, and it's, it's great to be able to be that way. So the gender unicorn is, I love this graphic, because there's a lot of aspects to what we talk about as far as LGBTQ. First, there's the gender identity. And this could, this is like male, female, non-binary, and whatever it is. This is your gender identity. This is how you identify. So I identify as male, for instance. But then there's a gender expression, and that can be also feminine, masculine, or other. And this one, people don't understand that you can, like, I could be male, but I could express myself as female or other, either sometimes or all the time. I mean, you're talking about like drag queens. They don't necessarily, uh, they're not saying I am a female. They're expressing their femininity. The sex assigned at birth is male, female, or intersex. There is a lot more intersex people than a lot of people think. There's as many in the world as there are redheads, for instance. So when you say the sex is assigned at birth, and this is a term, this is what was assigned to me at birth, that kind of thing. That term, I think, for some people is a little bit kind of, they feel like that's a little ticky tacky, but it's not. A doctor is the one who determines what your gender is at birth, and they make that determination based on just like the obvious factors that they see. They don't do tests to see if there are, internal organs, and they don't run tests that check certain levels or whatever it is that you're at. So they know they have no real way of determining a lot of the levels of intersex that happen at birth. And then there's the people, regardless of identity or expression, who they're physically attracted to, and then who they're emotionally attracted to. And those are different things, because I had this stated to me by a woman. She said she was bisexual, in that she's physically attracted to both men and women, um, but that she was only emotionally interested in having an emotional uh, relationship with men. So, that can be different. All of these can be different. They don't all line up necessarily for a lot of people, and sometimes they vary. So there's also study that has found that the transgender brains are more likely to be, they're more similar to the desired gender from an early age. 160 participants, they did MRI scans, and this is a 2018 study. They found that the um, patterns of trans brains more closely matched the gender that they identified as. So, I think a lot of people have struggled with someone who, they have known always as one gender, then saying, well, this is really how I am. This is really who I am. I'm really female, or I'm really kind of a combination, or I don't really know where I am, but I'm not, this 100% male that everybody treats me. And I think they think that people are, making that up, or trying to be a certain way, or think they're trying on different things, but it's actually in their brain and how they think. Um, I have some memes that I've found recently, some things that I found online, and I like some of them. They're a little they're a little edgy maybe, but this is one I think it kind of hits home. Is every transphobic argument can basically be boiled down to I don't actually know the science at all or have a good argument here, but trans people challenge my long-held view of the world, and it's very uncomfortable, and everyone should be expected to move around my discomfort. So what about pronouns? You know, what are they? How important are they? What do we need to do? First of all, transgender is not a noun, it is an adjective. They're not a transgender, they are a transgender person. I usually use trans. I hear that being used a lot in the LGBTQ community, trans male, trans female, that kind of thing. It's a little quicker, easier. Um, a transgender male is someone who was assigned female at birth but identifies as a male. Likewise, a transgender female is someone who was assigned male at birth and identifies as female. So the name that a transgender person uses, that's not a nickname. My nickname's Chaz. I mean, that's how most everybody around knows me. My full name's Charles, but that just doesn't fit me. I don't like it. I don't want to use it. But Chaz is a nickname. That's not the same as saying, "Hey, I was Chaz, but now I am Kathy." That's a totally different identity thing. So um, there's nothing wrong with asking someone their pronouns. I like to offer mine in situations like crisis situations or when I'm doing an intake on a kid, because then they know. Sometimes they'll ask, "Well, what do you mean?" When you say your Chaz and your pronouns are he, him, like what? I had a kid one time say, What do you mean? What are you talking about?" And I'm like, "Well, I identify as male, and I didn't even ask, how do you identify?" And they're like, "Okay." So, that just shows them that, hey, you're sharing, so they can share. And I also had a kid react when I said that. They just lit up in the room like, "Oh, this person speaks my language. All right." They are important. They're very important especially for young LGBTQ people. They're not just words, they have a big impact. You can reduce the suicide rate or the suicide attempt rate significantly simply by using proper pronouns and the name that they want you to use. You're basically just saying, like, "Hey, I respect you, I care about you, you know, I'm gonna make an effort." So when we're talking about transitioning, there's a lot out there. There are basically two different types. There's the social transition and the physical transition. Um, so the social transition is primarily I'm going to use a new name. I'm going to use new uh, pronouns. I might change my hair. I might change my look, my clothing, stuff like that. And it can happen gradually. It might happen first when a kid asks their their close group to start calling them, you know, how they feel, start using those terms. And I've even come across it where I wasn't aware that someone was transitioning, but when I saw them with their group, they had a different name. And I that at that point I said, "Hey, hey, what's this? What's the deal here?" "Oh, well, so especially kids can try that out. They start sometimes slow, or it can be all of one, like, "Nah, I'm decided this is what I'm going to be. This is how I'm going to act. I want people to treat me like this because this is who I am." The physical transitions can be different. That is more where we're talking about actual um, changes in things, medical interventions. So hormone blockers that you hear a lot of. These are they're completely reversible, and they need to be implemented before puberty at if at all possible. Um, they basically block puberty from happening, And or if it has already happened, they stop it. And so it's the thing is when they go off of the hormone blockers, then puberty is allowed to go. So if you can get it done early, when there's some kind of question going on, it will help the kid. Nobody wants to go through puberty twice, I always say. So, yeah, the best thing to do is as soon as there are any questions or concerns or thoughts, uh, get them get them to a hormone doctor, get them to an endocrinologist so they can talk to them and figure out what is the best procedure for them. Other surgical interventions are there's top surgery, there's bottom surgery. Those are kind of self-explanatory. I'm not going to get into the particulars. Um, you can do a cross hormone treatment, and that can cause irreversible effects. Um, there have been lots of studies on a lot of this kind of stuff. And it's really just helping someone present more closely to the way they identify. So we have parents who sometimes don't understand their kid is saying, I want a new name. This is, it's been Mike. This has been Mike. We made him Mike, and now he's saying he's Sally. I don't understand. Or like, what? You guys are doing this at your hospital. You're because maybe it's the first time they've heard their kids use these terms or say these things. But we don't want your straight kids to be gay. We just want your gay kids to survive. And I'll say this again and again and again. If you use affirming language and respect for kids, they're going to be able to find their true path much more easier than, if you deny and make them stay in the closet and make them wait until they're older to try to find out about themselves. When talking with parents, you've got to always realize that they have their own process. Um, Language we use with parents, we try to remind them that pronoun usage is not permanent. If it's a kid who is, again, questioning, trying to figure stuff out, and they try on different pronouns, or they say they're non-binary, or they say they're, this or that, they have these feelings, they have these thoughts. It may not be a permanent thing, but that doesn't mean that you shouldn't take it seriously, and that you shouldn't, you know, try to support them. If they say this is how I am, this is how I feel, then go with it. Don't question them or battle them on that. You give them the ability to figure it out on their own. Um, you've got to, we ask the parents to just sort of support their kids and go with it. And regardless of their beliefs or their feelings, to just help support their kids. They have their own process, parents do, and you might think parents who are going to be completely and utterly supportive, or who aren't, and that may surprise you, who is and who isn't. And even the most supportive parents I've dealt with, some are really close friends of mine, um, have have misgendered their kids by accident, especially starting out. Um, they have and they've caught themselves, or they're talking to me, one on one, and they use the old gender term, and I'll stop them, and I'll say, hey, I thought her pronouns were she her, not he him. Oh, you're right. Oh well, it's just us talking, and I've said this to my friends. I said, like, dude, if you're not using it with me, then you're not thinking the right way, maybe. you know Try to use it whenever and however you can. Um, and you got to be supportive of the parents, and you've got to help them see that their support of their kids is kind of the number one objective here. You also have to remind the kids that, hey, like, dad has had 12 years of having a daughter, so having a son overnight is not something that he's probably going to be able to handle right away. So give him a little grace, give him a little time, help him to work through it. So when you're asking someone, what is their gender identity or sexual orientation or something like that, just ask for the word or, what the way that they describe it, because they might describe it differently than male, female. You may give them two choices, a binary choice, or even three, and they may not have any of those. They may not know. They may say, well, some days I feel more like, feel more feminine. I feel more masculine. Sometimes I changes within a day. um, Ask them to tell you how to explain it. We've actually changed on our intake charts. We've changed the wording in order to say like male, female to these open-ended questions so that when the kids come in, they know that everyone has asked this and everyone has the ability to, identify themselves the way they want to. So what are some issues in treating patients and treating kids and students who are LGBTQ? The main thing, and this is like counseling 101, is with anybody, you can't steer them in a wrong direction if you're not steering them at all. Um, and I think it's really difficult as a parent or an old person, who's seen it all and I've experienced this and that, it's sometimes difficult to say like, hey, I don't know better. I don't know better than you, and to give a person that space to figure it out for themselves and support them, and help them to ask questions and figure it out without having you direct or tell them what to do or how to feel. Our job is to hold their hands and just try to support them and figure it out and be like, yeah, dude, this is difficult. But I don't have that answer for you. You have that answer somewhere in there, and we're going to figure it out together. But I'll be here no matter, well, what you're thinking or what you're feeling. Also, if you're talking to someone who is LGBTQ, make sure that's even something they want to talk about. You might get all into thinking, especially with the risk factors and with this and some of these studies I've showed you, that maybe LGBTQ is, oh, I got this, this gay kid comes in and he's talking about this and that, and it's because he's gay. Well, it may not be. Maybe he's fine with it. Maybe he has great support. Maybe he's come out to his parents long ago. Everybody is great. Everything's cool, but he's having problems because of this or that or something else. Make sure that that's even an issue. If it's not really an issue and it's not something that they're coming to you for, then maybe it's not something you have to talk about. So what can you do? I think the first point here is, my whole spiel here could really be boiled down to just make an effort. um I've seen it where people have a lot of trouble using new pronouns, especially for a kid. And I get that, especially if you're used to it. And I understand that. But you got to think about it like, you give them a beautiful, wonderful Christmas gift um, because they are a girl or a boy, or because they're that person. They're still that person, whether they're male, female, non-binary, whether they change their name, they're still the same person. You're just giving them the support. You're telling them, hey, I'm going to work at using the name, using the pronouns that you've told me that you want. That's the number one thing you can do for any kid, for any person, anywhere, is make that effort. And you're going to fail, especially if you have known this person for a long time and they've changed, and they're presenting a different way, they've transitioned socially or even physically. It's going to be difficult for you. And if you make a mistake, just apologize and move on. Don't make it about yourself. Just say, oh, I'm sorry, it's da da da, then go on and make like it's not a big deal, because you know it is a big deal, but don't make it that you're the big deal. for making the mistake or for doing something incorrectly. Accept them. Don't get caught up trying to be perfect. As I said, just try. Don't dismiss or patronize. I've seen this, and I've seen this even in schools with counselors who have said to me, well, so and so, she thinks she's gay, but she's really not. I know what da 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 is. She's just doing that for attention, and okay, so maybe that's true. If it is true, I mean, that should be something that the kid figures out, or is on the kid. That's not something for you to decide. And if you do support them and say, okay, I hear what you're saying, I support you, that's great. You can think in the back of your mind anything you want to. But if you support them and give it your all, they have now discovered that regardless, you're someone that they can go to and trust. And you're going to be that way for other students and other people. So I there was a guy that went to the P flag meetings all the time who always said, find family in those who accept you. And he talked to these kids, you know, he was he was very he was very old, and I thought when I first saw him, like, this dude's not gonna he's not gonna connect with 13, 14, 15-year old men, gay boys. He's just not, but he did. And they love to hear him say things like that, because you've got to find your own people. I've had a lot of discussions lately with people who don't get along with their own siblings, don't get along with their own families. Um, but they sure as heck get along great with other families they've made. So I think especially for LGBTQ, it's important to help them find that family or become a member of that family. So here's another thing. I I had one experience where there was a school system that went around to the teachers and said, "Hey, uh, we want to put up these safe space. The rainbow thing just said safe space signs in classrooms," and a few teachers refused. And I still I still have a problem with that attitude from a teacher because regardless of their beliefs or what they feel, their job is to make to make a kid feel safe. So this meme I thought kind of talked about that very well. Is you don't have to accept them or the thought, or if it goes against your beliefs, fine. You don't have to accept any of it. You're just not allowed to terrorize people because of who they are and how they believe, just because it doesn't agree with yours. So, what else can you do? Well, we need to have easy access to information for LGBTQ folk and for, ally. Safe space signs, like I said, all over the place. We have them in our hospital everywhere. I always talk about this. I wear on my badge, I wear a pin when I'm at the hospital that just says ally, and it's a rainbow. It's literally, it's just, that's all it is. I should probably wear those to my presentations when I do these remotely. But uh, I get a comment if there are kids around me, I get a comment almost every time. I had There were two adolescent girls who ran down the hallway and said, "Cool pin," and it's just a pin, and it's just identifying me as an ally, but they recognize it as, hey, this is someone I can be, I can feel safe with. Um, it's really simple, guys. It's just show that support. You can sponsor a group or a club if you want to help. I know the Gay Straight Alliance. I have here coming up here. I have the way to contact them. Um, you can start those clubs. Um, that can be kind of dicey sometimes. I know for some of our small rural towns. But I think the more we make it normal, the more we make it available, the more we make it in our everyday language, the more that we accept, and the more that we promote, and the more that we just let people find their own path, it's going to be safer and better for everybody. Um, Train and educate yourself. I updated this presentation uh, earlier this week, even though I've given it I don't know how many times, with new information, with new uh, thoughts I thought that would kind of help people kind of spur on the conversation. So, like I said, don't be afraid to train the people around you. Don't be afraid to step in. And this is not just with LGBTQ, it's with anything. I think that if you find someone uh, who is not maybe promoting healthy attitudes, that you kind of had that obligation to say, this is really, this is what the studies say, this is what it means, regardless of what your Facebook group says, here are the facts. And I can, be supportive, say like I can help you with that. I know, because at one time, I had no idea. Like I said, when I joined Lincoln Prairie, I did not know very much. I've had to do the research, I've had to continue my education, and I learn something almost every time I present as well, especially if there are kids involved. So just keep learning, keep changing, keep growing, keep learning. So this one says, when I was in middle school, I learned there were only two genders. When I did my bachelor's in biology, I learned there are also people who are intersex and the importance of the SRY gene. When I completed my master's in neurosciences, I learned that sex is already hard to define and gender is both social and in the brain, and that everything is a lot more complex. So when people say it's basic biology, they're telling you they haven't moved past middle school. Um, I mean, I find that kind of funny, but also true. There are so many elements, there are so many even genetic identifiers that you take a room full of 50 men who are 100% sure that they're male. And if you did certain tests on them, you would definitely find that not all of them are the atypical, quote, biological males. They might have uh, some sort of hormone differences. They might have some sort of gene differences. There's a lot out there that we don't, that we, the layperson, does not understand. Here are some resources. Um, PFLAG is a Parents, Friends, and Family of Lesbians and Gays. It's an organization I've worked with. Unfortunately, the Springfield chapter has recently closed. I would expect that they would come back around here in the next year or two. Um, Coral is an organization in Springfield that is Coalition of Rainbow Alliances. I love those guys. They are there to sort of gather, refer, do a lot of assisting people finding resources, and help. A lot of great people there. They put on a gala every year that we sponsor every year, and it's a lot of fun to go to. GSA is Gay Straight Alliance. The Trevor Project, if you're going to follow one, I think, kid based, adolescent based thing on Facebook, the Trevor Project provides a lot of stats, it provides a lot of resources. It will help you to learn, it'll help you to see things. Some of the graphics I've given today have come from there. There's a lot in there. And then there are a variety of other places, including, Family Acceptance Project, Trans Student Transparent USA, and then the Phoenix Center in Springfield is also a huge LGBTQ organization here in Central Illinois. So that is it. Um, I am now going to take questions if people can still hear me. Still hear me? Those resources, if you wanted those, like, I can send out the presentations, the resources, anything. I can send you a bunch of fun pictures and whatever. Have anything in the chat?
I screenshotted those the two of those memes that you had, Chaz. I really liked both of those.
Yeah,
Um, I
thanks.
think so much. I had a moment this summer. My kids go to Catholic school, as most of you know. And so they came into my high school office and saw that I had the inclusion sticker outside of my office window, and they were just asking me about it. And I just said, guys, I said, regardless, and Chaz, you touched on this, but regardless of somebody's ideology, whatever, I mean, I think it's most Christian to be reaching out to everyone. And I said that to my kids. I said, you know, people in certain communities, I said, and certainly the LGBTQ community are some of our most vulnerable population, people who most need us to be kind and be inclusive. And Chaz, what you said about the letters and A for ally, Q for questioning, those are extremely important to a lot of people. And I explained to my kids, a lot of people's identity, their only identity at the moment, is very much wrapped up in that. I said, so it's a matter of looking at the person, see the human in someone rather than. And again, my kids are little, and I'm glad that we had the conversation. It's important for them to understand that from an early age. But if you could talk a little bit, Jazz, just about maybe just how people can best ally themselves with kids, listening and all of that. And we got another
Yeah,
question in the chat too.
you touched on a word that I probably need to revamp my presentation to include um, is vulnerability, because you kids who are LGBTQ are uh, at more risk for abuse, at more risk for, being exploited, being uh, for violence, for and a lot of it, it's kind of like someone maybe who's on the spectrum, or someone who's uh, developmentally disabled. They would say something along the lines of, like, well, hey, you're just some, queer kid. Who are they going to believe, you or me? That kind of thing. I think the best way to help a kid who's LGBTQ is by, I mean, this is gonna sound hokey, but listening and just maybe stating, hey, I don't have the answers, dude, and like you know who you are and what you are, more than I ever will, and you maybe you be confused by that, but I'm here to help you figure it out. Instead of and just really just saying, hey, I'm in your corner no matter what. That's the best way. Again, when you offer information first, and as a counselor, I know you're not supposed to share, but in this situation, when you share your pronouns, and when I started doing that, when I'd go out on crisis, I did it once to an 80-some-year-old lady who, was suicidal in a hospital bed. And I came in and said that. And she had no idea what I was saying or doing, or it didn't have it. but but I also felt like, hey, I can't pick and choose who I say, hi, I'm Chaz and these are my pronouns. You do it with everybody. If you do it with everybody, you'll be surprised. And I had this once, and there's a nurse at one of our local ERs around here who said she came, there was an adolescent or a young adult that was having some issues, and when she came in and shared her pronouns as she introduced herself, she said that patient flipped a switch just like that and was just fine with her the entire time. And that's all it took, was her sharing that. So it's pretty elementary. Um, Again, just a little effort.
And that identification too of I'm at least trying. I'm here for you, and I'm at least trying.
Right. Like I say, I'm not an expert. I mean, I'm certainly not an expert. I mean, I am not LGBTQ. I'm cisgender. I don't identify in any. I'm boring as far as that goes, and that is fine. But I think we all, we all kind of need to do our part. And
And I think, I mean, we all in some respects have to educate ourselves. I mean, whether experts or not. But again, this being that vulnerable population, and I think, and correct me if I'm wrong, Chaz, but I feel like moving forward, the last 5 years have probably been a better and more accepting time in history. I say only the last 5 years, just thinking of kind of where I'm at and how many people have, been more open to discussing this with me. So I feel like in some respects, and possibly that's because I'm working largely with middle schoolers and high schoolers as well. I think there's more acceptance than I've seen. However, Melanie has a question in the chat that I
yes,
think
she does. I don't
absolutely.
know. I don't know that. Your question is, how have the new anti-trans policies affected schools? I don't know. I'm not in a school system. I do know that there's a lot of questions. There's a lot of thoughts going on right now. I know over the last, like I said, when I first started really working on this, like as you said, about 4 or 5 years, there's been more acceptance. There's been more ability to sort of figure things out. Um, and when that ability and when that openness is kind of taken away or is being stepped on, there are a lot of people out there in the LGBTQ community who are scared right now, um, because of a lot of things that are being said. Like we're not going to, do this, we're not going to do that, blah blah blah. Policies, etc. I think it really varies depending on the school system. I mean, or the school even, maybe not even maybe within a district. Are there any educators on here who know?
I was gonna say with us, I've not seen or heard anything quite yet. Come down the pipeline one way or the other. I'm not
I,
not entirely sure. Paula, do you know
I,
of anything? Oh,
I
sorry.
Same
see.
here. Nothing has come to the surface yet.
Peg's not in her head. Yeah. Um, yeah. I think we just, again, just like with anything else, you just got to do your best and help those kids figure it out. And it's
Absolutely.
12 o'clock.
Any further questions for Chaz, either in the chat or anybody wants to ask at the moment?
Hey, I'm free to do this, by the way. If anybody has an organization, a school, a group, or anything like that, I'll do it online. I'll do it in person, whatever. Um, I've got a few other presentations I do. I'm actually working on one for DCFS right now that has to do with remote working and psychological aspects of that. I write a weekly or a monthly blog, not weekly, thank God, monthly blog, and I've had people from the community help me out with those blogs and give me some insight, trying to share that information. The other one I do is on teens and technology and sort of like the social aspects, the aspects of the growing brain, how to kind of keep kids safe, that kind of stuff. So if anybody would like me for their organization, just let me know. We'll see what we can do.
Fabulous. And you did Teens and Tech for us earlier this year. That's on our YouTube channel. That was absolutely phenomenal, as is this one. Chaz, we appreciate you. Thank you so much, as always.
Thanks for
Folks,
having me.
absolutely. Thanks for being here. Folks, our next meeting, and I will send this out 1 month from today, Thursday, March 20th, and we've got 3 presenters there. Going to be very exciting. We'll get that info sent out as well as today's meeting notes. Chaz, if you don't mind sending me your slides, if you don't mind me sharing those with the resource page and all of that, would be phenomenal.
All right.
Much appreciated, my friend. Thanks to everybody today. Have a great rest of your day. Stay warm.
Thanks, guys.
Thanks again.